Welcome to Learn with Lutronic, a webinar called Volumization with Low Downtime, New Genius Lift Technique and Review. We are fortunate tonight to be joined by Dr. Heidi Prather from Westlake Dermatology and Cosmetic Surgery Center in Austin, Texas. Dr. Heidi Prather is a board-certified and fellowship-trained cosmetic dermatologist that specializes in laser and surgical aesthetics. She is trained at UT Southwestern Medical Center, University of Pittsburgh Medical Center, and Skincare Physicians in Boston, Massachusetts. She exclusively practices aesthetic dermatology in Austin, Texas at Westlake Dermatology Cosmetic Surgery Center. Dr. Prather is active in her field as a clinical investigator with numerous peer-reviewed journal articles and a leader within dermatologic academic societies. She currently is the PI for clinical aesthetic studies with Galderma and helps support the Clinical Research Center at Westlake Dermatology. She is co-chair of the Media and Public Relations Committee within the American Society of Dermatologic Surgery and participates on committees for the American Academy of Dermatology and the American Society for Lasers, Medicine, and Surgery. Her expertise extends to working as a trainer and educator for multiple industry leaders in lasers, injectables, and skincare, including Allergan, Galderma, Merz, Lutronic, Montec, Revision, PCA, L'Oreal, and SkinCeuticals. We are very fortunate to have her take us through her experience with Genius and the Genius Lift, and I'll go ahead and turn over the webinar now to Dr. Prather. Heidi, please go take it ahead. Take it away.
Hi, thank you so much for having me share my experience about the Lutronic Genius device. We're really excited to be providing this educational opportunity so that everyone can learn more about the technology that Lutronic has integrated into this device platform, but also the clinical skills to apply it for patient care and patient outcomes. Today we're going to review not only the standard core technology that really differentiates this device from other radiofrequency microneedling devices, but go over a couple different treatment techniques that we can use for what I call prejuvenation, or we can take that to the next level of intensity for actual lifting and explore more aggressive uses of the device. I'll also be sharing some of my personal experience and offering some question and answers about anything that might be on your mind for the device. It's first important to take a step back and understand the histology and pathophysiology of what we are doing with treatments. And most people come in for treatments wanting some kind of anti-aging, and what anti-aging really translates to is boosting collagen and elastin in the skin. And in order to attain these goals, really we want a multi-level treatment that we can customize for each patient. And this is a unique device that allows us to customize not only the depth, but also the coagulation zone that creates that elasticity response in the skin. You can see here the microneedling device in the red box with the green circles indicating the coagulation zones at specified depths, and comparing that to other devices available on the market. Traditionally, in order to get skin tightening and collagen repair, we had CO2 ablative devices at our fingertips that created a lot of pain, a lot of downtime, and high risk for infection, where it truly created an ablative zone of almost tissue necrosis and vaporization in order to get that contraction and tissue response. Later, we were able to come out with smarter technology that's less painful that we call non-ablative fractionated lasers, and those just create columns of heat in the skin. And these zones generally will go through the epidermis into the superficial dermis, minimizing any risk of scarring or deeper injury in the deep dermis. With radio frequency technology, most of the devices offer bulk heating or have non-insulated needles. But what's even more unique comparing to devices that have insulated needles is the ability for the Genius device to have real-time feedback controlling the impedance and temperature, creating these zones. And so I'm going to take you step by step while each part is very important. But what I love about my personal treatments that I customize with patients is we can estimate the depth of the skin and very easily toggle from a more thinner patient who might have to do more superficial settings, to perhaps men with thicker skin, and actually be able to target and go deeper and do something different for each patient. And because of the way the device has been manufactured and the treatment modeling exists, the downtime is really minimal compared to some of these traditional treatments for elasticity and collagen response. So here is a picture of collagen and elastin in the skin. We all want to look like the box on the left, where you can really see that boost of collagen and elasticity, creating that hydrated, three-dimensional picture that you see. As we age, our elasticity and collagen decreases, becoming more weaker, more disorganized, and not allowing to support the skin in the same way. So how do we get that back? Well, we want energy-based devices that are going to give more long-lasting results. And as such, we're going to create a lot of savings for our patients, because these aren't products that are going to be temporary in time, but actually almost like working out at the gym, giving us lasting integrity to that skin health. And so I call this the natural filler. I still use fillers for my patients as an adjunct because I think it gives a nice synergistic response. However, this is going to be that foundation of your treatment support for creating healthy skin for patients. And the Electronic Genius device does so by creating these precision pulses. And so it's the only device on the market that really has honed needles that are going to go to the depth that you specify on the machine, and due to the impedance feedback, give you the temperature that you think you're delivering based on the device. And that's very, very important, because sometimes we rely so heavily on these screens giving us the information at our fingertips, but we want to know that we can trust the manufacturing and how the device is built, and that it is really doing what it says on the screen. And so this creates a lot of confidence, not only in us as physicians and providers, but also for patients, because we can get consistent results due to this intelligent device. And so the tag for this is intelligent volumization, because we really want to do more than just put heat in the skin. We want to put heat smartly in the skin so it does what we want it to do. Here's a short video introducing the device. You can see the interface is very easy to use. Each treatment tip has 49 needles on it that go to the specified depth that you indicate to target collagen to improve scars, laxity, and contour on the face. And I'll take you through some of these settings to show you how you can achieve these results in your practice. And so when you're programming your device, you have the flexibility to go from 0.5 millimeters into the skin, which would be a very superficial treatment, to 3.5 millimeters deep, which is very significant and useful when treating scars or incredibly thick skin. Because we're treating in different depths, we want that real-time feedback so that we know that the heat delivered is the same across every needle, every time. And this device is real-time measuring the impedance with every pulse. And so we'll get that active feedback, and you'll see the output on the screen, so you know and you have the confidence that you're getting the outcome that you want. And this allows us to, one, we have two settings to treat in an easy mode, and the easy mode really does all the hard work in the math for us. And then for those of us who like to drive faster and explore what devices can do, I always compare this to, Ford versus Ferrari. And when you drive a Ferrari, you don't want it to be in automatic mode. You want to have your gear shifter and be able to kind of really customize the controls of that piece of machinery because it's made so well. And similarly here, you can kind of shift out of that easy mode and really customize treatments once you have a better understanding of how to create those coagulation zones and customize them for each of your patients based on what they're coming in for. And this allows us to really have this fractional 3D remodeling at our fingertips and can be used for a wide range of applications, from scarring to skin laxity. We can use it in thick skin or thin skin, and we can use it even safely in darker skin types as well as lighter skin types, as long as we're really creating that custom plan for that patient. And I love this comparison of an energy-based filler. And I think when you start using skin health as your goal, we really want to be treating on that deeper layer to boost collagen naturally and long-lasting. The comparison with Sculptra is amazing because I actually will use it with Sculptra quite often because of that biostimulatory response to really even enhance that improvement even more. But you don't need the filler to get this filler-like response. And so here's what the screen looks like. We do a number of passes depending on the effect that we want, from 1 to 3 passes on the skin. You're going to start at the first pass at a deeper level, so deeper in the skin, higher depth, and then decrease that depth with each pass. In energy mode, you can adjust the depth and the needle energy, which is the energy per pin, and the wattage is calculated, which is the power behind it, to keep that in a safe zone to not overheat the skin. The depth is very precise because we use high board quality needles that really don't dull with treatments, and the motor in the machine does not allow for any resistance in the skin to kind of bounce back, where you might be getting a more shallower depth than you think. And I'll show a great video that really illuminates that as well. The needle energy gives us the output based on real-time impedance monitoring. So it's going to be adjusting, giving you that energy with each pulse, no matter what the resistance is in the skin. And these are the 3 steps to get to that 3D fractional volumization. First, we need accuracy of insertion with the needles. Second, energy control, measuring the impedance real time so that the treatment is the same every time with every needle and every pulse, and that intelligent feedback that keeps things consistent and safe. Here is a histological modeling from skin biopsies on H&E staining in the skin, demonstrating different coagulation zones between different devices. On the left, you can see that on that 49-pin plate, you get very consistently spaced, same-size coagulation zones in the skin. When you compare that to another device, you can kind of see that there's actually a little line of necrosis at the top and a small coagulation zone in the dermis. And this is due to that lack of impedance feedback in the skin. And looking at the needles, and this is going to be that insertion point allowing us for accuracy of depth, because if you have a dull needle or a large needle, it may just bounce back off of thick skin without you knowing it, and you're never getting to the right depth. On the left is a picture of the Genius RF microneedling device needle. You can see how precise it is and how thin it is. It's approximately about a 34 gauge needle, so very fine. And the bore has this beautiful bevel to it, and so it really kind of slips into the skin with minimal trauma, minimal resistance, and doesn't get that bounce back that you can get from other needle insertion points. It's polished, so you can see how there's really no roughness to it. And this is really controlled by Lutronic themselves. We always think about this with skincare, right? We want skincare companies that control all the ingredients that they put in, so we really can depend on the accuracy and the quality of what's being used. And this is a great example of that in the device industry, where the needles are controlled by Lutronics. They're made in-house so that we get this precision with insertion depth. Here is a great video, and you can see with the Genius device on the left how the needles insert beautifully without resistance or gap. In the middle, you see this gray area, which is the resistance of the skin pushing against the needles. And so you're actually getting a more superficial depth than you realize. And compared to the last video, and these are all different RF microneedling devices available on the market. This one's a little bit better. The gap is a little bit smaller, but still present. But that's going to influence your treatment depth. So it's important to know if you have a device that has dull or orthogonal needles or doesn't have the necessary torque on the motor to give you that consistent treatment. And when looking at temperature, why that active feedback is important is your skin response is going to be different based on different amount of heating. If things don't heat up enough, you're really not going to have much response at all. But if it heats up too much, it's going to vaporize the tissue. And while you might get contraction, you're not going to get that same elasticity response. So our goal zone is this thermal coagulation that will create volumetric repair of elastin and collagen. And so on this bottom right, this is what we want things to look like histologically. On the top histology photo is an example of desiccation where the tissue is pretty much almost ablated here. And when looking at the thermal zones, we really want to be kind of in this nice sweet spot where we're denaturing but not destroying. And Genius is able to achieve that in a predictable manner. Now that we have this device that can deliver energy that we know is going to boost collagen and elastin every time, I want to walk you through some examples of what different energies look like in the skin. When looking at lower energies, we have a smaller thermal coagulation zone as pictured on the top left. And we can customize this and increase it with increasing energies of millijoules per pin. As we increase it, and we can compare this all the way to this bottom right of 100 millijoules per needle, which is a very significant amount of energy, you can see that it really elongates that coagulation zone in the skin. So you get a much larger size of injury in the skin. I usually try to treat around here at 40 millijoules per pin and usually do 2 to 3 passes and start kind of decreasing the energy as I get more superficial in the skin. Here is an example of an actual treatment, and I'm just going to go ahead and play this so you can see. And as we're going through and treating with each pulse, it's really important that you maintain a perpendicular contact with the skin, that you have contralateral kind of taut pressure on the skin, allowing you to stretch the skin so you have a taut surface that you're treating into, and you're avoiding treating into areas of laxity. And that you wait and treat before moving the handpiece. And you can see that it lights up red and green, so it kind of tells you when it's delivering the pulse. Some mistakes I see people make are moving the handpiece too quickly before the pulse is done, but you have an audio and visual cue to prevent you from doing that. And that allows you to deliver that entire bit of energy where you specify it based on the controls. There's also a ton of literature out there that has been published in peer-reviewed journals demonstrating this response of volumization in the skin and safety. And so let's go through some before and afters and talk settings for when you get this device into your practice so you know exactly what to do. This is a picture from a colleague of mine, Dr. Weiner, and you can see here when you're looking at the jowls that after 3 treatments, there's a nice improvement in skin elasticity through that jowl. And even looking at the fine lines and the pre-gel sulcus here at the marionette appears to be much smoother in my eyes. overall, she has a better luster to her skin afterwards. And it could be due to just investing in the skin and using good skincare, but it's also certainly a part of that improved elasticity and collagen in the skin. And again, using a different technique. This is photos courtesy of Dr. Ibrahimi. And you can see these deep acne scars in the cheek. After 3 treatments, and this is a darker skin type patient, I would say probably Fitzpatrick skin type 3 to 4, you can see that she has safely been treated without any post-inflammatory hyperpigmentation in her cheeks. When we start going into the lifting technique, we start increasing the energy per pin and intensifying that treatment so we can get a little bit more improvement with each treatment. Here is a great example of a patient of Dr. Posner's that has significant improvement in the acne scarring on her cheeks. She doesn't really need a whole lot of help in her jowls, but the Genius Lift technique is an advanced treatment that's great for people who need more elasticity improvement and maybe aren't really ready for a facelift or aren't severe enough for a facelift. So think about your patient that's going to be in their 50s, perhaps have some acne scars, and you just want to be careful in darker skin types and make sure that you're really doing the higher energies at a deeper depth, and that is key. You don't want to be doing high energies or high heat superficially in the skin because it's not going to give you the lifting that you want, and also is going to increase risk of post-inflammatory erythema and post-inflammatory hyperpigmentation. So once you've mastered the classic Genius treatment, I definitely encourage you to explore more educational opportunities to get comfortable with this technique and start integrating this into your office. For patient treatments, and I honestly offer this to almost all of my patients because you just don't know patient downtime, expectations, or sensitivities. And really making sure patients are comfortable helps them come back for that second and third treatment. I offer numbing at a minimum of 45 minutes and usually a little bit more than an hour topically. And if somebody's really sensitive or I'm going to these deeper depths, I'll even offer blocks where I'll do an infraorbital block, supraorbital block, and mental block for these patients. Especially if you have laughing gas in the office, that's a really, really great adjunct to so many treatments, and I think has a huge role here. And the more comfortable the patient is, the more you can really kind of push these boundaries and create more intense treatments that are going to give you more aggressive results. The downtime is a little bit more the deeper we go and the more energy we put into the skin. Usually patients are going to be red for 2 to 3 days. They can have some post-treatment edema in the skin, and we'll talk about how that can influence your treatment technique. And so advising patients to sleep with their head elevated, to use cool compresses every 15 minutes for the first day, and consider antihistamines even pre-treatment can be really helpful. I find putting patients on antihistamines prior to the treatment can help minimize the amount of edema in the skin, especially for people who tend to be very dermatographic, because you don't want to do one pulse and have them instantly welt up if they tend to be, you know, those patients with high histamine levels in the skin. And so managing that can make your treatment a lot easier and the patient comfort and downtime a lot less. And because we are targeting collagen in the skin, it's a true wound, and wounding can take 3 months to really maximize that collagen response. And so while patients will be healed much sooner, so I usually find that patients find the downtime to be pretty tolerable, very minimal, and at 1 week, 100% recovered, that their collagen is going to continue to improve, and therefore the results are going to continue to improve. While you're treating, cool air and Zimmer is a must, especially for darker skin types and these deeper treatments, because we want to minimize that heat sitting in the skin. It keeps the skin and the needles cool, helps patient comfort, and really helps distract the patient as well. And when you're treating, because of that instant kind of welting that can occur in the skin, you really want to think of the skin and treatment zone into segments. And you want to treat a small segment at once, doing every pass and every depth that you're planning on before moving to the next segment. And this allows you to prevent that intrapass edema that can take away from some of the results that you can see. This example shows the right cheek segmented into 4 quadrants with segment 1 and 2 labeled. And so what I typically would do is treat all of segment 1 at my deepest depth, my second depth, and if I'm going to do a third pass, I'll do it at the third pass as well before moving to segment 2. And the reason is when you're layering, the first pass is going to be that deeper insertion, getting that deeper dermal layer to really boost your collagen and elastin in the skin. And you want your second pass to be about 0.5 millimeters more shallow, with the caveat of you don't want to do high energy treatments less than 1.5 millimeters in the skin. So typical insertion depths might be 3 millimeters and 2.5 millimeters. In somebody who's a little thinner, you might be at 2.4 millimeters and 1.8 millimeters in the skin for these first and second passes. This image really emphasizes the need to minimize that intrapass edema by doing small treatment segments at a time. And so it's not appropriate to do the first pass on that deep insertion, high energy, to that full face or a large treatment area, because you give the skin time to swell. And what happens with energy and energy into the skin is you start to recruit a cellular response that's going to start releasing fluid in the skin, and you get what we call intrapass edema. That intrapass edema is going to change the treatment depth, but also the impedance in the skin. So you won't be able to get the same energy delivery on that second pass if you do so while the skin is red and swollen. So on the right would be the correct method to deliver, where you're segmenting into smaller areas, you're getting that second pass in before edema sets in. And here is a demonstration of how the power affects the size of injury in the skin. And so what this is imaging here is the needle insertion. You can see the insulated portion in the epidermis and the uninsulated portion extending into the superficial dermis and reticular dermis in the skin. The green lines indicate the thermal zones, and as you increase the wattage or the power behind the treatment, you can elongate and create a larger coagulation zone in the skin. Therefore, you're treating more volume in a three-dimensional perspective and going to get more improvement and repair. This can be useful in customizing treatments, but is also important to think about when we're performing our treatments, because we don't want to be doing really high energy, these long coagulation zones too close to the surface of the skin in a darker skin type patient to help prevent thermal injury that may lead to post-inflammatory hyperpigmentation. And here's an example of same millijoules per pin, so same energy that we're delivering in the skin, but what we've changed is that power and the pulse duration. And so on the left, we're doing a lower power, 5 watts, at 600 milliseconds, so a much longer treatment time, but effectively delivering 60 millijoules per pin in that small, tight circle. On the right, we're changing the power, increasing it to 15 watts, decreasing the amount of time for skin exposure, but getting that same effect. And a lot of times patients are actually going to be a little more comfortable with the treatment on the right because it's going to be a shorter duration, so they're going to feel that heat much quicker. And this is what it looks like in the skin. And so you can see you get these really nice, tall, oval-shaped coagulation zones, which personally is what I like to treat to. So on the right is a classic setting that I would use. And this is illustrating the needles in the skin overlaying with the histology. So how do we get these perfect results? First, good treatment technique. And we saw a quick video, but again, how to get that application. You're going to stretch the skin taut, place the applicator tip perpendicular to the skin, and then treat. If you're treating on an angle, the device is smart enough that if some pins aren't all the way in the skin, you will get an impedance error, and that could be some feedback that if you're getting a lot of yellow airs on your device, that you may be doing improper placement or not holding the applicator tip in place for the full treatment delivery. And another pro tip when you're treating at these higher energies and trying to get this lifting technique, impedance becomes more important, and you're more likely to start to get impedance errors, which would show up on the screen as a yellow or red feedback indicator saying that the impedance is not being delivered correctly. And if you get the right amount of tension on the skin, you can oftentimes eliminate that air and allow the energy to be delivered into the skin effectively using this contralateral tension. So you're going to be pulling in one direction, and while you're delivering and keeping the device steady and perpendicular on the skin, really kind of pushing against the direction that you're pulling with your hand. And so the device will be pulled in that contralateral direction while your hand is creating a nice top surface moving in the opposite direction. Okay, here's a great example of one of our esteemed colleagues here. And we're demonstrating the active application of the device with that contralateral tension. You can see that the skin is marked out into these segments so that you're not allowing for intrapass edema. And we're also demonstrating the 50% overlap rule, which we will get into, which really shows appropriate technique. When you're treating with 50% overlap, I usually average about 200 pulses per cheek, 100 pulses per pass, which is a good average there. But this slide, while very science-based, really sums up what makes Genius different from other devices on the market. And just like when we look at our laser energy delivery curves, where we want that top hat to be nice and even, energy even across the pulse duration, we want the same thing with our radio frequency microneedling devices, where the energy being delivered is constant throughout the pulse. This graph shows that the Genius device is achieving that through the real-time impedance measurement, allowing for a steady state of power and energy into the skin. And the green line shows the impedance in the skin, while the blue line shows the power delivery, and it makes that beautiful top hat that we want to see for an effective pulse. And when we're delivering each of these pulses, we want to make sure that we are staggering a 50% overlap in each direction, so not just one direction. The top visualization demonstrates a 50% overlap in one direction. But as we move horizontally across the skin in our stamping technique, keeping all the techniques we just talked about, skin taut, device perpendicular, we want to be moving it over incrementally, just ever so slightly for that 50% overlap. And when we get to our second row, again, just moving it down ever so slightly to go back through with another 50% overlap. And this effectively is giving us 4 passes. So really high density with our needle passes. And because the device is so easy to use, it's a very quick treatment. You can really get a lot of passes in a very small amount of time. I typically will treat about 1,200 to 1,500 pulses in a treatment. Usually takes me about 30 minutes to deliver that many pulses. And the output energy that I typically look for is about 2,000 joules per treatment. So let's look at results of what the lifting technique can do. We've already seen these photos of Dr. Posner's patient with the acne scarring. This is really impressive as well. Another patient of his with a darker skin type. And again, I can't emphasize this enough because the technology is so great when used safely and effectively to prevent post-inflammatory hyperpigmentation. But you can see the improvement in the static rhytids on her cheek, as well as the improvement in laxity of her jawline. And this is after 3 treatments. And I can't emphasize enough, especially when doing lifting treatments on patients who have more prominent laxity, to really get them to commit to those 3 treatments and treat as a series. For our practice, we do offer package discounts when patients buy a package to really help get them to psychologically and physically buy into the idea of doing more than 1 treatment. What happens when patients check out with just 1 treatment is they forget you ever said that they needed more than 1. And generally, they expect more out of that 1 treatment. And while I do have so many patients that are very, very happy with just their 1 treatment, you're going to get so much more enhanced results by helping guide them through a series that's spaced usually about 4 to 6 weeks apart. Certainly, if you're doing lower energy treatments, which I call more prejuvenation settings, you can space those a little closer together, more like 3 to 4 weeks. And the higher the energy that you're going, you may want to space it out a little bit more for about like 4 to maybe 8 weeks between treatments. So why did I choose to invest in Genius? Well, I got very lucky that our practice invested in this machine. We have multiple locations, so we have a lot of providers who are using this at their fingertips. And what we have found is that with intelligent volumization, you really get natural results, and it resonates very well with patients who are targeted about skin health. And I find, I live in Austin, Texas. People don't want to look fake or plasticky. They want long-lasting results that feels like them. And I compare this a lot to going to the gym. So just like going to the gym, we want to take care of our bodies and our muscles. Same thing with our skin. We really need to be doing things to help improve our skin health in a way that we can maintain that integrity of collagen and elasticity. And this is the device that does that. And so you get the precision depth, the precise delivery of energy, and you get this intelligent response that you have the confidence that you can treat patients well every time. Because this is a company that invests in their technology and really micromanages the device by customizing the needles, making sure that everything is just top of the grade. And the device is really easy to use too. So you can really kind of customize how you want to use it. You can make this a really easy treatment that you delegate to staff and just keep them on the prejuvenation kind of easy mode settings. But you can also make this almost a more advanced treatment for your providers to really get a little bit more response in the skin. And I like the name Genius Lift because it really is that non-surgical approach that I think is the latest technology to not replace facelifts, but really give us another tool in our toolkit to offer patients who are just not ready or don't need to go under the knife. And how do I market Genius treatments to patients? Well, marketing becomes, a very big question based on your own practice and kind of how you reach out to the community. But once a patient is in the office, I find that this becomes a natural adaptation to almost all of my patients' treatment plans. And I'm really surprised sometimes at how often this comes into their top 3 treatments for their treatment plan for the year. And it is because of exactly what I just mentioned about it being a natural way to enhance skin health. And everybody needs that, no matter what age, you know, you're starting to look at these prevention and rejuvenation treatments. The RF microneedling device by Genius is safe. It can be used in all skin types and can be customized for response for all ages. And so it really becomes a great fit for anyone who walks through the door. And during the consultation process, and I think this is key, whenever you're consulting with a patient, and for those of you who are already in a cosmetic practice, I'm sure you do all of these things already, but if you're trying to build cosmetics into your practice, I think it's really important that you first start by asking the patient what their goals are. You know, get permission to do the consult and to give feedback. Feedback can often be perceived as being intrusive if it's not desired. And so the goal here is to really boost people's self-esteem, not to take it down. So ask permission when you're doing consults and get an idea of what their goals are. You know, is it just one line? Is it overall aging? Do they just feel like they look tired? And once you get an idea of what is bothering them, you can start brainstorming all the tools that you have to address those needs. Budget is always going to be some concern, but most patients are willing to invest in their skin, and they want an unbiased idea of what you recommend without budget aside. So I typically will save budget to the end and get a full plan in place, and we'll start treatment on the plan and create that calendar agenda based on their budget. So if they want to do everything at once, we schedule it that way. If they want to space it out over 2 years, we schedule it that way. And then getting an idea about downtime. And so this is where you want to evaluate their expectations. Some patients don't mind having a lot of downtime, but if you can feel out in advance in the consultation if this is going to be a patient who's going to be very, very sensitive to any kind of redness on the skin, a very busy social schedule, you're going to want to help prep them for more treatments with less energy delivery so that they can get those same results in a mindful way without, you know, interfering with their social life. However, if they're willing to schedule in, you know, a day or two of redness, it really gives you a lot of flexibility to get some fast results with 2 to 3 treatments. And always dig deep about family history, personal history. Are they acne prone? Do they have a history of cold sores? Do they have a history of post-inflammatory hyperpigmentation? I often will grab people's arms and look at their scars on their arms to see if there's any delayed redness or brown spots from previous injuries, you know, from cooking, whatever it might be, to give me a feel for how they're going to heal. And that can save you a lot of strife if you can prepare for skin prevention and healing. It can really give you better results and have a better rapport with the patient. And so patients who are going to be prone to hyperpigmentation, I will put on a pre-treatment plan and a post-treatment plan with brighteners. I will often even do a lightweight topical steroid if they tend to be really, really red after the treatment, just to help minimize the heat in their skin, but I don't continue that more than a day or 2 because we don't want to have any side effects from it. And then, of course, if they have a history of cold sores, I'll prophylact with antiviral treatments. And if they're really acne prone patients can just be really sensitive to any kind of treatment in the skin and get reactive acne, some inclusion milia. And I find that really giving them good steps in terms of post-care and not being too aggressive with occlusive creams can be very helpful. And really setting expectations. And so they need to know that while they'll love the first treatment, getting 3 treatments in and spacing them in that kind of 4 to 6 week range are going to give them the true genius results. And you can integrate this so easily. And so again, when I talk about skin, I start with the foundation of skin health, which is the skincare portion, and talk about enhancing collagen through device technology and how it works with appropriate skincare. But then we want to also address the superficial skin, pigment issues, dynamic lines and movement, and it becomes this almost tiered approach to really setting the foundation with a treatment that creates this intelligent volumization like the Genius RF microneedling, and then taking care of the detailed work on the surface of the skin and addressing those lines and brown spots. And this has been a real hit in our practice, which has made it really, really easy to get familiar with the device just because of how often it is used. It's probably one of the more popular treatments in all of our offices that house this machine. And the reason is patients want something that's natural and long lasting. And they're willing to come in for those series, which is really helpful too, because the downtime is not significant. I often actually am surprised at how often now I think our treatments have gone up post-COVID and post-isolation, because more and more people are working from home, have more downtime, and really want to utilize this time as an opportunity to invest in their skin. And this is a great place to start because you really get such well-rounded results consistently. And the key word here is intelligent volumization, because this device offers precision that allows us to have clinical confidence with every treatment. And that is our Genius RF microneedling device by Lutronic. Thank you so much for attending this virtual workshop. I hope you found some useful tools at your fingertips to really bring this device to life in your practice and optimize your patient results.
Okay, thank you very much, Dr. Prater. That was a very excellent presentation and much appreciated. I'd love to try and share a few questions that we've collected, and some are coming in live. I'm trying to group them together for you. One question that's had a lot of hits is, if you could just maybe explain again why the Genius is different and potentially better, as you've just described, for lifting compared to other RF microneedling devices. Maybe you just could review that again as to what makes it different and better.
Thank you. I think that's a great question about the superiority of the delivery with the Genius RF microneedling device. And it really comes down to that coagulation zone. You need a reliable coagulation zone at the right temperature, the right size, the right depth, in order to optimize the amount of volumization and elastin and collagen that you're going to create in the skin. And that requires a device with highly bored needles that are going to go to the right depth every time, that has a strong motor in the handpiece to avoid resistance of the skin that might bounce that needle back up, and real-time impedance feedback, which is basically an active thermometer for each needle on that treatment plate to give us the feedback that we're delivering the right temperature to remodel the tissue in an optimal fashion in the skin. And this is the only device that really does all of those things for you.
Excellent, excellent. And maybe you can review again, how many treatments are typical for this type of lift technique in your practice? And what % of patients, I think you mentioned it earlier, what % of your patients that get the first treatment come back for, a second or third? It's kind of a double question.
I think that's a great question about frequency of treatments and expectations. I group my patients into prejuvenation, which are going to be younger patients with less skin laxity, less jowling, less sagging. And I will do lower energy treatments for that population. They tend to be more comfortable, they want less downtime, they're more active, and they honestly just need more maintenance, almost like going to that gym regularly to really create the health in the skin that's going to give lasting results. Those patients, I typically will actually space out a little bit more, just because they tend not to want the extreme results quickly. But because it's so easy, they often come back sooner and just want to do it again. When I'm doing more lifting technique, it tends to be a little bit more uncomfortable. I always pair it with laughing gas, topical numbing, and sometimes even injection blocks, depending on how sensitive the patient is. But to be honest, the laughing gas, oh my gosh, does so much for patients. And when I transition them to that, it's almost the only thing that they need. And for lifting patients, I do space it out about 6 to 8 weeks between treatments because I want to give some time for that collagen to respond, but also just give the patient a little bit of a break. They're going to be red for 2 to 3 days. They do respond very quickly, but because it is a little bit more uncomfortable in clinic, I think it's nice to give them a little break, maybe do their neuro relaxers in between, and then have them come back for that second treatment. And oftentimes a third, especially for people who are on the older side, have more skin laxity and need more of a response in that jowl.
Excellent, excellent. Another question it gets asked pretty often is if you can describe maybe the price range for Genius or Genius Lift treatments, and especially for these patients that are seeking the non-invasive tightening and lifting without those risks of downtime and surgery. Is there like a range you provide, maybe depending on the patient, for one of these Genius Lift treatments?
Yes, so pricing is so generous in Texas, so I feel like it may not be comparable to other places in the country. However, we price our treatments at $1,500 to include face and neck. And I think of that as a certain amount of pulses and energy delivery. And so when I'm doing the lifting technique, I compact the number of pulses and energy into that lower face and upper neck area. And when I'm doing a more prejuvenation setting with lower energy, we'll get that same total output, but I'll deliver it in a larger area. And so $1,500 is probably kind of a premier pricing, even in Texas, for laser and device treatments. If we were to compare that to, our Fraxel Dual, we charge about $600 to $700 for the face for that treatment. And so you can kind of see that triage there. And I find that patients are very willing to invest at this range. And because the cost of goods is so low, your really investment cost is $125 disposable for each patient. And what's great is it's made so well that you can do almost as many pulses as you want. I think it's been tested up to about 2,000 pulses, which will really allow you to even cover face, neck, and chest with one treatment tip. And it really allows for a lot of flexibility in how you offer your treatments, but also maximizing the patient experience and the practice income.
Dr. Prather, how would you compare again the patient tolerance? I know it sounds like you might do some more things to make them comfortable between numbing or laughing gas or even blocks. When you go from a regular Genius treatment to a Genius Lift, could you describe again what you do to make the procedure tolerable for patients?
Tolerance with treatments is really going to be related to the depth and energy that you're using. I have personally received treatments on the easy mode with zero numbing and zero prep, and I find it very easy to tolerate, but I do probably have a higher pain tolerance than some people. On the contrary, when you start getting into these lifting techniques, because you're doing so many pulses and it's such a big area, I think it's a lot to ask of people to do without any kind of additional kind of comfort and distraction techniques. When I first started, the only thing I did was topical numbing, which was sufficient. I would say on the cheeks where we went the deepest with the highest energies, if you're doing more 40 millijoules per pin, which is a more moderate lifting technique, and doing more passes to get to that same cumulative energy of about 2,000 joules, then comfort level will shift more to about a 4. But the laughing gas just allows such a really effective distraction that when I use it, patients don't really complain of any discomfort at all.
Excellent. Another question is, what other treatments do you combine or bundle with Genius Lift? I think you might have mentioned this even earlier in the presentation, but maybe you could share some examples as to what things often go together for certain patient interests.
Combination therapies is a huge focus right now, I think, for everybody. A lot because patients want to maximize their visits with their physicians and providers. And I would say probably the most I do would be, I would start with Sculptra and treat with that in the face or the chest. That has the added benefit of having some lidocaine in it, and so you're going to get a little bit of comfort already. You're treating on a deeper plane, so supraperiosteal on the face, and so that's not going to interfere with the energy delivery of the Genius device. And then I'll go into the Genius treatment and treat the deeper dermal layers to really boost that collagen in the deeper skin for that lifting technique or just overall rejuvenation. And if somebody has a lot of pigment, a lot of superficial sun damage, I'll often top it off with something like the Laze MD, which is going to be a 1927 nanometer device that's going to be targeting more superficially in the skin. So again, not treating at the same layer as the Genius. And that's important because you really don't want to, bulk heat the skin or cause large amounts of injury. And the Laze MD can be great at just kind of smoothing out the treatment, giving you a more even response, and kind of blends any little square pulses that you might have made. So when the patient goes home, they just look nice and red and even everywhere. But it's going to target more of the pigment in the skin as well for brightening. And it's very, very easily tolerated to add that on afterwards. And I think creates a more comprehensive treatment for the patient. I always compare it to a layer cake. And so the Laze MD is going to treat that icing while the Genius is treating the cake itself. And so you kind of want those working together.
Could the Genius lift technique, can that be used in areas other than the lower face, maybe like on the body, for example? Have you had any experience or have explored that?
Absolutely. And I think this is one of the more exciting uses of this technology because there are so few devices on the market for body treatments. And so I have used it for patients that have asked for tightening and improvement on the lower back, on the stomach, on the knees, the elbows, again, the chest, which I kind of lump into that face and neck area a little bit. The biggest thing that you need to be mindful of is this skin has less sebaceous glands, less stem cells, so overall healing is going to take longer, and prepping patients for that is helpful, but also making sure that you don't overwhelm the skin in terms of treatment density and being mindful of the number of passes that you use. And what's great is Lutronic has actually come out with a body tip to make these treatments more accessible and easier for you. But it can certainly be done with the original handpiece as well.
The question is, can the 50% overlap in both directions, as you identified in the presentation, and those segmenting techniques, can they be used for, besides Genius Lift, can they be used for regular Genius treatments as well? Is that just kind of a good practice that you've established, or what is your thought there?
Again, when you do these 50% overlaps, you're really increasing the density and it acts almost like an extra pass. So it really depends on your goal. I like doing things a little bit more aggressive, and so I tend to do the 50% overlap for all of my treatments, whether I'm doing a prejuvenation or a lifting treatment. And to me, the difference is the depth and the energy that is being delivered. The 50% overlap can certainly be done no matter what technique you're doing, but density of treatment does increase risk of post-inflammatory hyperpigmentation. And so whether you're getting to that density with the number of true passes or you're doing the one pass with 50% in both directions, so it's effectively 4 passes, just be mindful of that.
Why did you choose Genius for volumizing and lifting treatments over other systems?
The accuracy and technology that has been put into the device, I think, make it a superior option. When you're thinking about delivering energy into the skin for lifting, you really want to know that you're getting to a precise depth that you can customize from patient to patient. And it's an easy choice when there's not a lot of other options that have that flexibility and intelligent reproducibility.
Okay, terrific. Maybe if you could comment a question about the percent of patients in your practice that end up choosing, based on the consult, the Genius Lift treatments in terms of the energy you use versus regular Genius treatments. How have you seen that mix shift, during your consults? Is it half and half or 1/3, 2/3? What does that mix look like?
The tendency for patients to pick an easy mode prejuvenation treatment versus a lifting technique are really based on desired outcomes and downtime. We price them very comparably, so really that is taken out of the equation. But I do find that younger patients who have less downtime tend to gravitate more towards the rejuvenation treatments. And it's just a no-brainer because it's painless, you can pop it in, almost no downtime. But the more treatments that you do, you're really creating some long-lasting rejuvenation and skin health. And I think skin health is really a target goal for everybody right now. My patients that tend to gravitate towards the lifting technique, I do a little bit more coaching and preparation in the clinic visit. So they're prepared for the experience, they're prepared for a little bit more downtime, and they're more invested in it knowing this from the beginning. But I think really kind of creating that system in your mind of where the patient fits and then choosing for them is the key. I think it's really hard and you confuse patients if you just give them the option, would you like a rejuvenation or a lift? They want the best treatment. And so you need to have a great idea in your mind, what is the best for that patient based on your consult process, goals, downtime, and expectations.
Excellent. Maybe just one last question, Dr. Prather, and that is, and this can maybe be short because you might have touched on this a little bit, is generally the idea of, doing good treatments that meet the patient's goals. But what settings primarily do you adjust when you want to get basically desired patient results faster with fewer treatments? Is there one particular, I think you mentioned wattage, you mentioned millijoules per pin. What do you normally adjust, to try to do fewer treatments and get faster results for the patient? Does that make sense?
Yes. So everyone wants to optimize their clinical treatments because, the time we invested in our patients is valuable to us. And we really want patients to leave satisfied, but we want their treatment experience to be efficient and effective. When I treat patients, I typically will do 2 passes in the key areas with the 50% overlap in both directions, so I know I'm getting a big density. And the way I optimize and control the modes, I gravitate towards taking it off energy mode, which I lovingly call the easy mode because you don't really have to think about too much. And when you take it off energy mode, you can really control the power or wattage and the duration of delivery and get an output millijoules per pin, which is going to be the output energy that the skin sees. And that is really the target number that I document, that I chart, and that's my goal. I titrate the power and the pulse duration based on patient comfort, skin thickness, and really optimize it to make sure that I'm not getting any errors on the machine. Because if you're doing any pulses and starting to get that yellow feedback saying that there's an impedance error, and the yellow is the flash on the pulse, and you'll get a little chime with it, you need to dial back on the energy being delivered, dial back on the power sum, and start kind of changing that coagulation zone shape. But if I can, I like the higher power because I want that longer coagulation zone, because in my mind, I feel like I'm effectively treating a larger volume in the skin, 3-dimensionally.
Excellent. Again, very thorough response. So much appreciated. So Dr. Prather, we'll probably wrap up there. I know that I want to be sure that any viewers watching the webinar, they know that probably within a few days of the webinar, we'll have this posted on our website. and for continued education and follow-up. But again, I want to thank you, Dr. Prather, for your time and your assistance with presenting a great webinar about Genius and the Genius Lift and volumization. We really appreciate your time, and everyone can have a good evening.
Well, thank you so much for having me. It's always a pleasure to educate and to share. And I really enjoy my experience with the Genius device. So happy to be here.
Great. Thank you very much, Dr. Prather. Have a good evening.
Thank you. You too.